Community health centers have been around for more than 60 years, started at the grassroots level, very local, to meet the access to care issues that people across the country were experiencing due to rural areas, for example, like where we are today. Rural areas don't always have access to primary care services, dental services, behavioral health services. And so how do we ensure that everybody has access to health care that they need and that they deserve? And so that's really where health centers came in back in the 60s. So come to 1980, Choptank was born. In the same way, there were a committed group of people in Caroline County who had the heart and the passion to bring this together and to make it happen. Last fall, we started talking with Shore Health about, what could we bring to the community? What does the overall wellness and health strategy look like for Kent County? And it evolved from there. It really made sense for us to bring what we do so well to the residents of Kent County. Shore Health and Choptank have been long collaborators. It just makes sense for us to work together. We have the same mission, basically. We want to improve the health of the communities. And so how do we do that, and what does that look like? In the other counties that we serve, we're doing the primary care, we're doing the dental care, and we are beginning to offer behavioral health services in our locations. And so we partner with them on referrals for specialty care, for example. So that's a big piece of that. Throughout COVID, our teams have worked very closely together to figure out how we're going to meet the needs of the communities, because nobody can do all of that on their own. And throughout COVID, so many partnerships, I think, have been strengthened through necessity with emergency operations centers and the health departments and the hospitals and the federally qualified health center, Choptank. So a good example of that recently is Shore Health has partnered with us and with the local health departments and the schools to provide the Pfizer vaccine to children ages 12 and up. So Shore has the vaccine. Some of our staff has been helping actually administer the doses, and we're doing those in the schools. So we have a very robust school-based program in Caroline County and Talbot County, where we have basically a doctor's office in the school. So we have a nurse practitioner or a physician assistant who can do diagnosing, do lab tests. We can do COVID testing in school. Strep throat was always a big thing, over the years. Flu tests as well. Write prescriptions, physicals. So really being that resource in the school and part of that outreach model to take care where kids are. And I think that's especially helpful, as parents are working or working outside of the community, to be able to receive those services during the school day. If your child's sick, they're seen at school, the prescription is sent to the pharmacy, you pick it all up and you go home. You're not having to make all of those other stops along the way. We also do school-based dental services, and the dental services involve a cleaning. We do fluoride varnish, which is really like vitamins for your teeth, and then we do sealants, which stop cavities from forming in kids. And we have been working with the health department here to bring those services into the school, partnering with the health department to start that this past school year. Of course, there were other plans in the way, and we weren't able to do that, but we're looking forward to getting started when school comes back in the fall here. Yes, we bring a portable unit with us, and we have a space identified in the school, and the kids that are signed up for the program, we bring down and we take care of those oral health needs. And I think what's really important about that is if the dental hygienist identifies a cavity or decay, we help with those referrals back to their dentist. If they don't have a dentist, we can help them find one, and then certainly if they're a Choptank patient, we would refer them back to the office and help them get scheduled. So it's really about that continuity of care too. So when you're going out into the community and doing that outreach, you want to make sure that the work that you've done then is connected back, and so it can continue and the health outcomes can continue to be improved. So we are looking to open the primary care office in July of 2022. So we have more planning to do, we have recruiting, we have all the nuts and bolts to put into place. Well, I think we have a very diverse patient population, and I don't know that I could give you an accurate description of what that would look like, because there is so many differences across the programs that we provide. So, we provide services in schools, and so we're meeting the needs of kids in schools, right? We have non-English speaking patients, whether they're in schools or whether in our offices or whether they're in the migrant sites that we visit. And we make sure that we have people in place who can communicate and ensure everybody is on the same page with healthcare. So we have interpreters that speak Spanish. We have interpreters that speak Creole. We have a larger Creole population up in the Federalsburg area. So that's really important that we can connect everybody with care. And again, that all goes back to mission. But I think, again, we're here for everybody, right? And so I'm a patient. My kids are patients. And they love coming to Choptank because when you go into the office, you feel cared for, you feel valued, and you know that you're being heard. And I think that's what we all want. We want to know that our concerns are being heard and they're being addressed. So the services that we will be providing in Kent County will be headquartered in Chestertown, but we recognize that there are needs in the communities surrounding Chestertown. And so how do we reach the folks there? And again, it goes back to outreach. So we will be purchasing a mobile vehicle that we can take to different communities. So, for example, Rock Hall, Millington, Galena, and that van will be built out so we can provide medical care, we can do some level of dentistry, and we can do some behavioral health. So, we want to make those connections. We want to reach people where they are and then connect them to the primary care provider. So, when something does happen, when a health issue does arise, that you have that relationship with a provider. It's really important to establish that. So you have, your provider has an understanding of your healthcare needs, medications that you're on or may need to be on. So it's really important to establish that early. Yeah. And I think even more so as we've navigated COVID, many people have put off some of those checkups, if you will, if you're diabetic or hypertensive. I would just encourage everybody, now's the time to go back into those offices and get checked out, get your physical, because those things can grow and change into something bigger, and it's important that you take care of those.